This week, the federal government put forth its proposal to the provinces for a new healthcare funding model. It's a big deal, not just because it's always a big deal, but also because 3+ years of pandemic have stretched existing healthcare to and beyond its limits. With us for more, in Charlottetown, Prince Edward Island, Dr. Michael Gardam, Board Chair of Healthcare Can and CEO of Health PEI. And in the nation's capital, Marika Walsh, Senior Political Reporter for the Globe and Mail. Welcome to you both.
Thanks.
Hi.
All right, so Marika, let's start off with sort of the numbers. Let's crunch the numbers here. How much money is the federal government offering the provinces and territories?
It depends on which envelope you're looking at. In terms of the new money, what's different from what we knew in advance, the federal government's offering about $46 billion in new money over the next 10 years. That is on top of a significant base spending that the provinces and territories were already expecting, but it's far short of what they were asking for in terms of addressing the crisis in the healthcare system and what they said was needed to address that.
Now, Marika, in terms of reaction, words have been used as lukewarm, maybe not exactly like you mentioned the money there. How have the provincial and territorial leaders responded so far to this offer?
I would say that the overall vibe is a resigned acceptance. They know that it wasn't a negotiation with the federal government. They got an offer. They got essentially a spending announcement from the federal government when the premiers came to Ottawa this week. And so if they say no, they just don't get the money. So of course they're going to say yes. But certainly everything that they said showed that they were expecting much more from the expectations that the government was setting in advance of this meeting than they ended up getting. But given that they will take any money, they'll take this money as well.
All right, Michael, I'm going to quote Andre Picard, health columnist for Globe and Mail, friend of our program here. He wrote, "It's hard to believe that 2.5 years of public posturing and background negotiations produced something so utterly uninspiring and unimaginative." Is that a fair assessment of this offer?
Yeah, I mean, I usually end up agreeing with Andre, to be honest. I think that, as I think my own premier said, the money is great. We'll take whatever it is you can give us. But I think fundamentally, and Andre said this in his article as well, we actually have to get into the business of fundamentally reforming Canadian healthcare. And I personally, and I think Healthcare Can believes, we will suck up whatever money you give us, but really that's not what we're looking for. We're looking for fundamental reforms of the Canadian healthcare system. And we don't just want to keep slapping new coats of paint on a very rundown house. We have to have the hard conversations around what we do. Some of that'll be money, but we have to talk about what we do next to make a new Canadian healthcare system.
All right, I want to go back about 20 years ago, also a Liberal government. Michael, how is this offer different from the one signed in 2004 by Paul Martin's government?
I mean, it really is quite similar in a way, right? We're continuing to, fund the status quo, but we have to go back and look at what Canadian healthcare was when we created our public healthcare system. It was basically hospital costs and doctors' fees, and that was a time before we had ICUs and MRIs and all of these special cancer drugs, and it goes on and on and on and on and on. And all of these big funding announcements have been to try to prop up the existing system or add more things to it. But we've never gone back and actually challenged the fundamental principles about what we're doing here and whether we can possibly afford to fund everything that people think we should have. So in a way, it's just adding more money to the pile, but it's not really getting us to the point where we have to have the hard conversations.
Marika, does this offer come with strings?
So if I could just back up a little bit to tee off some of what Michael was saying, because I think there are some really important points here. And the question is also who is responsible for those conversations around the structure. I think the federal government in itself might have hurt itself by talking about sort of this massive influx they were going to put into the system. They were talking about changing the healthcare system. They were talking about fixing a broken system. Those were their words. And so then, of course, they set the expectation that we would see some sort of response to that. But the premiers are not looking to Ottawa to come up with new ideas and to innovate in their 13 healthcare systems. We don't have one healthcare system in Canada. And so I think it's also a question of organizations like Michael's are rightly saying there needs to be change, there needs to be structural reform. But is Ottawa the government that should be doing that? And I think many people would say no, because they are not the ones that hold the power, the levers on the system. And so people are looking to Ottawa for answers, but at the same time, Ottawa is not necessarily the best place to do that. And the premiers are not asking Ottawa to do that. They actually have made it very clear in these talks that you asked me about that they do not want Ottawa telling them what to do or how to run their system. There can be a debate on whether or not that is appropriate or whether the federal government should have more say in the matter. But how it's set up right now, it doesn't. And to your question on conditions, the strings attached, that's exactly where the rubber hits the road. The federal government appears to have decided not to put in a massive injection of cash beyond what it's already promised in the last election. But at the same time, it's not putting any consequences for that spending. So yes, there are conditions in terms of where that money can be spent, but there doesn't appear to be consequences for if a result isn't reached or if the money doesn't lead to better outcomes or shorter wait times.
Michael, should there be conditions or consequences, or should the provinces and territories spend their money as see fit?
You know, that's the big tragedy of Canadian healthcare, is that we've spent the last 60 years kind of pointing fingers at the feds, or pointing fingers at the provinces. I mean, from our take, you know, the federal government obviously has a role in setting those guiding principles, and probably most Canadians would agree with most of the principles in the Canada Health Act, right? If I get sick in Ontario, I don't want to be told that I'm not part of that insurance plan, therefore I'm not able to be treated. I think most of us would agree with most of the things in there, but we've really gotten to this point where, you know, the provinces have argued repeatedly, as was just said, this is their responsibility. And in the Canadian Constitution, healthcare is clearly the province's responsibility. Well, you know, to paraphrase the Spider-Man movie, with great power comes great responsibility. If you're going to own that, then it is up to you to reform it. And I think we're playing this game where they can hold off trying to make serious reforms because they can just get more money from the feds. And I think, honestly, that the provinces have to take responsibility for something that they say they own. They need to get into the hard work of figuring out, what does the future of Canadian healthcare look like?
All right, I want to get some reaction from the opposition parties. Marika, obviously for the Liberals, this looks really good. It's a nice win. What are the opposition parties saying about this offer?
The Liberals are sort of in the middle here, and I think they have cover because of that. The NDP say that the government should have actually spent even more than the massive amount that the provinces and territories were already asking for. They believe that Ottawa should increase its share of the cost to 50%, which would be tens of billions more each year. Meantime, the Conservatives, who are in official opposition, have not actually said, really, they never put forward their own proposals in advance of this announcement, these talks this week, but have said now that they will uphold what the Liberals offered in this 10-year deal if they form government. So there is maybe a bit more certainty for the premiers as to what's next to come, but of course we'll have more elections before this 10-year deal is up. The Bloc Québécois believe that the federal government should have met the premiers at their ask, which was to increase spending annually by $28 billion. So you see, you know, we're talking about these massive numbers, and all of these questions go back to what Michael is talking about as to whether it's needed to actually reform the system and to lead to better results. I think most people agree you do need some money to make change. The question is, what is sustainable for Canadians?
Marika, I want to stay with you. At the First Minister's press conference this week, Premier Ford had used the analogy that this was a down payment. Now, I know housing prices in this country are quite expensive, but this was a little bit more than a down payment. My question is, you know, is there a room for negotiation? Do we have an idea if the Premier is going to negotiate a better deal, or is this is it?
There appears to be absolutely no room for negotiation in terms of the dollar amount. Where there might be room for negotiation, and where the government says there is room for negotiation with the premiers, is where the money is targeted within the healthcare system. So some of the money will be spent through what's called the Canada Health Transfer, and that's the base funding that goes to provinces and territories that they can spend how they want to. And then there's other targeted funding that will go through separate deals. And it appears that there will be room for the premiers to negotiate where that money should be targeted. So, for example, in Nova Scotia, that means that a focus is on primary care because they have massive waits for family doctors and for family care teams. Similarly, in Ontario, it's expected that money could be targeted there. But there's other options to target it to mental health care, to home care, to long-term care, to wait times in surgeries and diagnostics. So there's sort of like a buffet, and the provinces and territories get to decide where that money in the side deals will go.
Michael, as Marika had mentioned earlier, it's a bit of an equation in terms of how this money is going to be spent and where it can come from. Should they accept this money or push for something more?
I mean, honestly, the priorities that were just mentioned are exactly what my priorities are. So frankly, whatever money we can get right now, I am very supportive of. It'll help us whether we spread it out or whether we focus on one particular area. I do think, though, we need to get to the point where we have got to stop throwing money at our healthcare system. We have got to start asking difficult questions about what we can offer, what we can't offer. I think one of the big tragedies of Canadian healthcare is the fact that we have 13 systems that don't necessarily collaborate. We should be looking at a lot more collaboration between provinces to try to decrease costs, and at the same time, centralize those high specialty, high cost services that we could centralize. Not every province has to have its own thing. There's a lot of provincial ego involved in this. There's a lot of duplication involved in this. And we just don't want to see more and more money put into the healthcare system without reform. It's more money and hopefully if we do that, we will start to find some significant efficiencies in what we do, because we just can't bankrupt the country, especially for a system which is not really providing the service that Canadians want.
Marika,
I think going off of that, there's a question of political will from the premiers, and there's a question of if they actually want to do that reform. We know from other provinces' experiences that when they try to do wholesale change of the healthcare system, they experience a lot of pushback, a lot of fear, and it really pushes governments and puts risks to governments' sort of longevity in the next election. And so there's a lot of reasons from an electoral prospect's perspective why governments don't necessarily want to enter into these whole-scale change discussions. And the question is, how do you get past that? When you look at Nova Scotia, for example, a few years ago, they changed how their health system is organized through the health authorities. And that essentially slowed down and froze the system as it tried to adjust to the new way of doing things in a way that then hampered healthcare delivery in the meantime. And that caused a lot of problems for the then Liberal government at the next election. And so it's a question of how these provinces and these premiers can actually do this while keeping the current train running. It's not an easy task that people are asking of the premiers, but it also doesn't seem that the premiers are that interested in it.
Marika, I want to ask you about one particular premier, one particular province, Ontario. The Financial Accountability Office of Ontario says the province has allocated $12.5 billion in excess funds over the next 3 years while spending less in the required healthcare. Break it down a little. Is this government justified in spending less on healthcare?
Well, that's not for me to answer, but certainly the federal government here has repeatedly pointed out that most of the provinces are currently sitting on budgetary surpluses while the federal government is in deficit, right? So there is a question of a willingness to actually spend their own money versus going to Ottawa with an open hand. And that, I think, is a question then for voters. Premiers will respond to what voters are demanding of them. And so it's also on voters to show up and to vote with their feet and show people what their priorities are. Clearly, we know there are surpluses now in provinces, but given the warnings of an economic slowdown, the pushback from the premiers is that they need long-term sustainable funding that they can depend on. And so fluctuations in a budget cycle do not necessarily mean you can build a whole new hospital, because will you have the money 5 years down the road to run it? So there's arguments on both sides, but I think it's clear from that report from the Financial Accountability Officer that more money could be coming from Ontario, at least for now.
All right, Michael, we talked a little bit about sort of where the money needs to go, but what areas of the healthcare system need that money urgently? And I'm wondering if you have some examples as well as sort of that strain.
Yeah, I mean, it's hard for people not in healthcare to understand how difficult the pandemic has been for healthcare workers. The whole population went through types of lockdowns and having to mask and things, but we've never left the pandemic. We're still masking, people are tired, et cetera. And so we have had a lot of people leave the system. So certainly Health Human Resources are absolutely top of mind. And really, there's no part of healthcare that doesn't require more people. The one that we talk a lot about is primary care, home care, seniors care, those sorts of things, mental health care. There's a huge need right now to try to bolster those systems. At the same time, it's not like we're flush with hospital beds either, right? We have the lowest number of hospital beds per capita of any developed country. We are tied for the bottom with the NHS in the UK. So we have no resiliency in our system either. So when a premier says, give us however much money you want to give us, we can spend it, it's really kind of true. We are really patching multiple holes at once. And it really speaks to, although I fully understand that premiers don't want to go down that road, we're reaching a point where they're not going to have a choice. I think the public is going to speak with their feet, vote with their feet, and just say we're not going to tolerate a mediocre healthcare system anymore at this point.
Marika, what do the premiers want to use this money for? Is it primary care? Is it mental health services? And are they in line with what the feds want to, or is there a discrepancy there?
I think they are in line. I mean, the federal government, as I mentioned, has given them several options for where they can focus the money. It's not yet clear how these side deals will work out. Will the federal government expect that money will go to all of them, but that it will be weighted for different areas? But François Legault, the Quebec premier, who I would say is among the most staunch people opposed to any conditions on federal money, said that, these are shared priorities. His priorities overlap with the federal government's priorities, so he has no issue dedicating that money to them. And we've heard a lot from healthcare professionals, and Michael can speak to this more, about the key of having a family physician to then access the medical system. And the wait times for family doctors are very high. In some parts of the country, more than a tenth of the population do not have access to them. So given that primary care is on the agenda for both the premiers and the federal government, you can see there's lots of overlap. The question is, what will be achieved with this money? What will the results be? And will voters and Canadians actually see a difference from it?
Michael, I'll get you to respond as well.
Yeah, absolutely. I mean, primary care is a huge focus across the country. I mean, here in my province, we're talking a considerably higher proportion than just 10%. And we're in the middle of a transition from solo practitioners into what we call patient medical homes, these group practices with a wide variety of different healthcare professionals in them. That's clearly the future. That is requiring a lot of money. I mean, one of the challenges we are going to have, and other provinces may have as well, is that most of healthcare costs are people. And if there's a real shortage of those people internationally, we could have the money and not be able to move forward with it if we're not able to hire those people. And so, it really is a highly complex system where you've got 100 leaks at once, and you're just trying to fix the airplane as we're flying it. I just think we're at a point where we truly need to do some foundational stuff, and just throwing more money at it is not going to get us to where we want to go. I live in fear that come this summer or next summer, we're talking whole-scale removal of services because we don't have enough staff, and it's even less about the money than it is being able to hire the people. That is terrifying for me, and it should be terrifying for Canadians because it's going to happen all across the country.
All right, I want to play a clip of Dennis King, Premier of Prince Edward Island, at the First Minister's press conference from a few days ago. Have a look.
I think what's lost in the conversations that we need to continue to focus upon is that it isn't just money that we need. We need innovations. We need to change how we deliver health care. We need to help innovate the healthcare system in many, many regards. And I feel the conversation over the last little while with the Council of the Federation and with the Prime Minister and with federal officials, we've led maybe Canadians to believe that money simply is going to fix this, and that is not totally accurate.
Echoing exactly what both of you have been saying, I do want to pick up on one word there, innovation. What innovations would you like to see in the healthcare system, Michael?
There's many. I mean, if we talk, first of all, that's why I love that guy, and that's why I'm working in PEI. I think we are very much aligned. I do think, though, that innovation doesn't have to always be technology, for example. So one innovation is this move away from solo practices into large group practices. Doctors are far happier there. They don't need to be the center of the universe, but rather their role can be to support all the other professions. It leads to less burnout. It's easier when people go on holidays. That's one innovation. A lot of the innovation here in Atlantic Canada has been around how can we collaborate on various things. So that really stands out in Prince Edward Island, where we're not able to provide all the services you're going to get in Ottawa. We just do not. We don't have cardiac surgeons. We don't have thoracic surgeons. So we are forced to collaborate with other provinces. We can do a lot more of that, right? We're talking about having one license for all of Atlantic Canada. We're talking about breaking down barriers to allow really Canadians who are training overseas, who right now all go to the US because we put up barriers to hire them. All of these things are kind of happening at the same time. So a lot of them are more business practice innovations rather than technology per se. But of course, electronic health records, gathering more data, proper use of virtual care so that we can get access to services we could never host in this province. All of those things are happening as we speak. It's going to take a few years for them to turn around, but we're getting there. And I'm fortunate to have a government here that actually understands it's more than money.
Marika, I'm going to get you in there as well. When we talk about innovations, we talk about the data collection. I think that was one that both the feds and the province all agree on there. And Michael touched on sort of why it's necessary. But when we talk about innovations, what can we potentially be seeing?
Well, and maybe to be fair to the premier, as you can tell from that quote from Premier King and from other premiers, that they are aware of this issue. They do want to work towards it and do appear to want to provide better health care. But the cynic says, well, you spent the last 2 years debating money instead of having these roundtable discussions maybe about that innovation that Michael's talking about that collaboration, about why is it that we have different credentials for each province across Canada and that it's not the same across. So in terms of what innovation is, I can't speak to what it should be. That's really for Michael to say. He's the expert on the front lines. But we know that all premiers have agreed that it needs to happen, that there needs to be change. The question is, what do they actually do and how fast does that happen?
All right, in the last 2 minutes here, I got 2 questions for you. Michael, I'll come to you first. As Canadians, this is healthcare is something that we are very proud of. But over the last couple of years, and obviously the years before that, we've seen the kinks and sort of the shield has some damage to it. Should Canadians still be proud of their healthcare?
I think that we should be proud that we have a socialized healthcare system that's universal and it is transferable. And so we're not like the United States. However, I'm glad to see that the air has been let out of the great myth that we have the best healthcare system in the world. We don't. We have one of the worst performing healthcare systems in the world. And as long as we keep comparing ourselves to our American cousins, we don't look so bad. But if we compare anywhere else, we really don't look very good. So I really believe Canadians should be proud that we have the spirit of helping other Canadians, and our healthcare system is in dire need of reform.
Marika, you get the last word here. What are the next steps? What should we be looking out for?
Well, very quickly, we'll see the premiers meeting on Monday to discuss this deal. And we know that the federal government wants these bilateral deals to target certain areas of healthcare to be in place within the next few weeks ahead of the budget cycles this spring. So I think that will be sealed up quite quickly. And then the question is, do the premiers continue this discussion, or now that the money's been set aside, does the discussion stop?
Marika, Michael, thank you so much for joining us on the program tonight. Really great stuff.
Thank you.
Thanks so much for having me.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.